Hello, my name is Alexandra Pitman and I'm a consultant psychiatrist in North London and an associate professor in psychiatry at University College London. And I've been asked by the Academy of Medical Sciences to talk about the issue of loneliness and social isolation in researchers because I co-lead with Sonia Johnson the Loneliness and Social Isolation in Mental Health Research Network. Now, this is one of 8 UKRI-funded mental health research networks, and we've been in operation since the end of 2018. And over that time, we've been drawing together a massive evidence that describes the link between loneliness and social isolation and mental health problems, both new onset mental health problems, but also the worsening of existing mental health problems. So now during coronavirus, we're obviously concerned about a range of vulnerable groups, and that includes people who work in research settings. And that includes both clinical researchers who may have the opportunity to go into work in clinical settings and connect with their clinical colleagues, but it would also include people who do not work in clinical settings and some who've had to stop all their lab work and may feel particularly isolated at this time. Now, data have been collected on samples that include researchers in clinical and non-clinical settings to try and understand how they are functioning at the moment, how they rate their loneliness, and how they rate their mental health problems, to really try and understand what's going on for them. But it's early days and those data haven't been analysed as yet. So all we can say as a research network is to report back on the examples that we see amongst our partners and in university settings across the UK of those institutions where there seem to have been good examples of trying to address loneliness amongst their research workers. And these examples seem to arise from individuals who are great leaders. They seem to be able to draw people together within their departments by starting up social engagements, perhaps weekly pub quizzes that they do online, or trying to arrange meetings which draw members of the department together, both to talk about research matters, but also to check that everybody's doing okay. In my own university, UCL, Human Resources have produced a web page called Remote Not Distant, and that's drawn together resources to help people feel more connected during coronavirus. And as a network, we would encourage universities to think about the resources that they can collect together on the internet to help individual researchers feel connected to others, but also to show leaders within departments how to take initiatives in drawing their research teams together and trying to mitigate the potentially harmful effects of the loneliness that people are undoubtedly feeling during coronavirus. Thank you.